Warranee. My name is Karen. I'm from the PHN First Nations Health Access Team. This is the second part of our Health Check 715 and the last of our support sessions presentations for the Quality Improvement Program. I would like to recognise and celebrate the diversity of First Nations culture and acknowledge and pay my respects to their elders past, present and future as the traditional caretakers of the lands, water and sea we are all working on today, and pay my respects to any First Nations persons joining the webinar today.
The learning outcomes for this presentation involves the nurse follow-ups, the allied health follow-ups, and the chronic disease management item numbers 721, 723, and the 10 care arrangement.
So upon completion of a 715 health check, if your patient was assessed at needing follow-ups health services, they can get 10 allied health services per calendar year plus 10 nurse follow-up visits per calendar year. Whether there be a nurse or an Aboriginal health practitioner within the practice, either one can see the patient to do these follow-up visits. Nurse and Aboriginal health practitioner follow-ups to a patient is to provide any assistance with services they're trying to access or any education on medications and prevention advice on their chronic condition or any examinations or interventions that were indicated by the health assessment. The MBS item number 10987 is the follow-up for First Nations people who've received a 715 health assessment, which includes the maximum of 10 services per patient in a calendar year. So the components of the follow-up item is what I discussed in the last slide, is to do with the examinations and interventions that was indicated by the health assessment and their progress and the services they're accessing, and just prevention advice for their chronic condition. This is for the allied health follow-ups after a 715 health assessment. So there's the allied health item numbers 81300 to 81360. So this is for patients that can have up to 10 allied health follow-up services per calendar year. And the services can include one of the same allied health, like a physiotherapy, or they can have a mix of services across those 10 services, which can be from diabetic educator to podiatry and physio, or even occupational therapy. There must be a written report, though, provided from the allied health professional to the GP after the first and last service, or more often if the GP has required that. GP management plan and the team care arrangement is for multidisciplinary care plans, and it's an attendance by a general practitioner to review or coordinate a review. So the GP management plan prepared by a GP or an associated GP, the item number applies is 721. For a team care arrangement which has been coordinated by a GP or an associated GP, the item number applies is 723. I've also included MBS Aboriginal and Torres Strait Islander health practitioner items for immunisation and wound management care. And there's also guidelines and resources for more detailed information and the MBS online website. This is just an example of a 12-month appointment plan for a patient that has a chronic disease. So then on day one you just do the GP management plan and the team care arrangement. And there's also nurse follow-up support for care for a chronic disease. Then you have your 3-month reviews, your 6-month review, your 9-month review, and after day 366 you can do a new management plan and a team care arrangement. This is about the referral requirements for your patient for follow-up service after having a 715 health assessment. And it's just who you've identified which allied health services the patient would benefit from seeing and how you refer the patient to the relevant allied health professional. So you can use a referral form for follow-up allied health service on the Department of Health and Aged Care website, or any form that the practice already has within their computer system. You can only use one referral form if you're referring to either of the following: a single service, the same service multiple times, or you will need to use a separate referral form for different service types. There will be changes for the Medicare Benefit Schedule MBS coming into effect from July 2025. These changes are going to replace the GP management plan and the team care arrangements. There's going to be a single GP chronic condition management plan. And this is to support patients who are registered for My Medicare to access management plans through the practice where they're registered. It's also to encourage management plan reviews, which equalises the fees for developing and reviewing plans. It also requires patients to have their plan established or reviewed in the last 18 months so they can retain access to allied health and other services. The formalised referral process for allied health service so they are more consistent with other referral arrangements. And to ensure patients do not lose their access to current services through transition arrangements for existing patients with GP management plans and team care arrangement. The health professional eligibility is either a practice nurse or an Aboriginal and Torres Strait Islander health practitioner. And once they've offered and provided the follow-up visits per calendar year, you can claim the 10987 attendance item number. There's also exemptions for an Aboriginal controlled community health organisation or a state territory government health clinic for item numbers 10987 may be claimed for services provided by a practice nurse or an Aboriginal Torres Strait Islander health practitioner on behalf of the GP. So supervision of the practice nurse or Aboriginal Torres Strait Islander health practitioner at a distance is recognised as an acceptable form of supervision from a GP. MBS follow-up item may only be provided if the service is provided on behalf and under the supervision of a GP, and the person receiving the service is not an admitted patient of a hospital, and the service is consistent with the needs identified through the health assessment, and a claim has been made through Medicare for a patient in respect of an MBS item number 715 health assessment in the last 3 years, and the GP under whose supervision the follow-up service to a health assessment are provided retains responsibility for the health, safety and clinical outcomes of that patient. The reporting requirements for review or follow-up services from the allied health professional: they must provide a written report with investigations, tests and assessments performed on the patient, treatment provided, future management needed, and where the allied health professional provide multiple follow-up service, they must provide a report at either of the following times: at the first and last service, more often if clinically necessary, or where they provide only a single service, they need to provide a report after that service. On this slide, I've added references for some websites and links that you can access at your own time with follow-up services and item numbers by a practice nurse or an Aboriginal health practitioner. I hope you find this useful. Health Pathways is a free website portal for clinicians, and you can access this on our PHN website, and you just need to do your own personalised login to access the Health Pathways site. There's a lot of information on this site, and there's a lot of links that can be opened, and there's also forms embedded in these links that you can either download as well. There is clinical guidelines and just resources on this slide for your use if you need any extra information or are looking for any type of support you might need to access for the patients of your health service. I would really appreciate if you could fill out this survey after you've finished watching the 715 Health Check Part 2. It helps us with our future presentations, and any feedback or comments is welcome. Thank you. We have Robbie and his beautiful family, and we have added the website for the PHN for our First Nations practice support sessions if you'd like to view again at a later date. Thank you for participating in the 715 Health Assessment Part 2 session. I would like to thank all the practices who have been involved in this program. It's really appreciated. Thank you.